Hello, welcome to Minds on Mushrooms, where we're unveiling the magic behind psychedelics for mental health and addiction. I'm your host, Maggie Kirkwood. Thanks for joining us. Today, I have with me Dr. Rachel Allyn.
Hi.
Hi, Rachel. How are you?
Good. Thanks for having me.
Thank you for joining. I am so thrilled you're here. I have so many things I want to talk to you about, and what I love is you are a psychologist and you are somewhat of a medical professional of sorts, or, I like to say professional.
I try. I mean, I have a medical license, a psychology license. So yeah, I've worked hard for that. So hopefully that counts for something.
Oh, it most definitely does. I wanted to kind of start off talking about, so with your practice, I wanted to ask you, I know that you get excited about psychedelics and the potential for healing and all of the wonderful things. How would it look for your practice, or what makes you excited about the potential of these plant medicines becoming legalized?
Well, what I really have come to learn and love about mushrooms, and of course within mushrooms, there's so many different strains and varieties, but there's some really amazing psychedelic mushrooms that can be a very graceful and gentle way to help people be more connected to their heart, to be more just connected, period, to nature, to one another, to their soul. Really, it helps people to get out of their, what I call the dysfunctional ego, or sometimes people call it like kind of that constructed personality. And it helps people sort of let go of some of those storylines of needing to be right, or holding grudges, or self-criticism, or criticizing others, a lot of those storylines. So as a psychologist, to find out that there could be something that is organic and natural, not a synthetic, not a pharmaceutical,
Right.
that can really help people to kind of soften, let go of their grip on those storylines and be a more kind person to themselves and to others, is really, I think, amazing and holds a ton of potential.
I often think in my relationship, going through divorce, if I would have been introduced to psychedelics earlier on, rather than like turning to wine or alcohol. And I know you do a lot of relationship counseling, right?
Yeah, I do a lot, whether it be with couples or individuals working on relationship issues. Definitely, that's a big part of my practice.
Nice. So yeah, I just often think about that. When you're working with people and couples per se, and trying to help them through some of their problems, do you see a way that the use of psychedelics could potentially help even more? I'd like to just hear you talk about that.
Well, you had mentioned alcohol as a way to cope. And I think that there's nothing wrong with human beings wanting to have ways to cope. I mean, there's nothing wrong with also wanting escapes from things that are hard in life. I mean, there's no shortage of things in life that are challenging that we want to escape from. But I do think that here we have alcohol is legal, and it the only problem is it really numbs people. It doesn't really help the issue go away. It kind of just sweeps it under the rug momentarily, and then if anything, you then have additional problems later if you overdrink. That your problem hasn't gone away, and you're also maybe feeling hard on yourself or hungover or whatnot. And so we have these things in the US that are legal that can numb us, but when we talk about mushrooms, it's really not about trying to kind of numb or escape. It's actually really about waking up. It's awakening. It's a way of getting more clarity and feeling more clear, more connected. And that's what I think is a really beautiful distinguishing factor, is that people aren't trying to run and hide. It's like you want to be kind of breathing and reaching out, and And so I think it gives people a way to say, like, I can cope in a way that is awake and full of clarity. And it depends on obviously the dose you're doing, and if you're doing a hero's dose or a microdose, but what the effects are going to be. But I think that ultimately we want to learn how to cope with challenges in life in a way that isn't about kind of like numbing ourselves out, but it's about waking up to our strength,
Mm-hmm.
to that self-love, to kind of our inner empowerment. And that's how I think we learn the lessons of these challenges in
Yes.
life, is not from numbing and running, but from like actually leaning into them.
It's so true. I think it's, you know, maybe it's very individual to families or whatnot, but I just think about some of these bigger traumas in my life, like a late miscarriage, for example. Um, just it was not that it was swept under the rug, but it was just kind of, it happened, and then you move on because there's no
Yeah.
like physical baby, or it's. But my whole point is, I just wish at that time, because it was
Yeah.
so easy for me to just turn to have some wine to
Yeah.
numb because I was just
Mhm.
trying to escape. And I think I was doing that with any sort of problem in my life. That was where I would go, or, to
Yeah.
release. And I think a big piece, and kind of relating back to that self-love piece, is actually taking that time to like, or go inward and heal and recognize there's something with the plant medicine that makes me feel like, I'm not the only one in the world going through this. Like, it
Yeah.
helps minimize, I guess, helps heal and almost minimize, not minimize, but make you feel that you're not suffering alone. Does that kind of resonate with maybe
Yeah.
your thoughts on psilocybin, I guess, or
Yeah.
healing through the
Yeah.
use?
Yeah, I think that, we all come with our kind of unique history and
Mhm.
our own life challenges, and our intergenerational traumas and backgrounds. And people we come at it, and we turn to this for our different reasons. But what we, I think, find out through the process of connecting to psilocybin, and is that there's this way that we're more alike than we are different. That there's this
Yes.
real connection that's about being human. It's about the humanness of what we're experiencing. And yes, I think that can help us to see that we're not alone, that others experience this. And in this time of such conflict and division
Hmm.
and such divisiveness, if there's something that people can take that helps them to feel more of a kinder connection to one another and realize our humanness versus this focus on how we're so different and
Right.
the name calling, that is a really beautiful medicine for our times. And
Yeah.
we've never needed it more.
I couldn't agree more.
Yeah. Yeah.
I wanted to touch, you just talked about intergenerational healing.
Hmm.
Um, can we, I'm just fascinated by that idea, and I don't know much at all. Can you give
Yeah.
me a little debrief on how, how you might work with somebody with that? Or is there like do you have a story or a situation that you can share about
Mhm.
anybody healing and working through inner?
Wow. Yeah. I mean, I could talk about my own. I know that everybody has some sort of, we come in
Mm-hmm.
with just like our family history, and a lot of it is also what we understand now scientifically, is that like really like on a DNA level, there's an imprint from generations and from the
Wow.
trauma that our ancestors have experienced. And I know within my own family lineage, there's been a lot of abandonment.
Okay.
So I sometimes, being a really intuitive person and a healer, I sometimes will have those feelings of abandonment that aren't even my own. It's sort of like this imprint in my own DNA, as far as feeling it about others, or just feeling it on a more collective global level, like this sense of there's a real epidemic of loneliness going on.
Mm.
And now, a lot of people aren't going to necessarily know how to connect how they're feeling to something that can be more pre-verbal, or really like kind of part of their DNA or part of their family.
Hmm.
And that's what
So
help with the therapist can do.
did you, okay, so with your own story, were you kind of recognizing that you were feeling these certain thoughts or feelings about abandonment, or how did you
Yeah.
know? I guess how I'm interested in knowing at what point was it, um, that you were able to realize, was it through the work that you went back and realized that there was a history of?
Yeah, just taking a really keen interest in my family on each side and my ancestors, and just first you need to, I guess, think about your own life journey with regard to your family, and
Mm-hmm.
then get curious and find out about your parents, your grandparents, cousins. Not everybody asks those questions, so
Okay.
sometimes that can provide some clues and
Mm.
puzzle pieces. So, as far as the intergenerational trauma, and then we can have traumas that are unique to us as an individual in our life, of course, or even
Mm-hmm.
just in our own birth, our own in utero trauma or trauma
Right.
coming out of the womb. So, um, and trauma is not all bad, too. I mean, there will be traumatic events in one's life. It's just a matter of how we coped with it at the time and coped with it right thereafter.
Okay.
If we didn't cope with it at the time or shortly thereafter, that's where it can actually live, kind of more in our body as far as
Mm.
nervous system reactivity and reactive patterns and tension in our fascia, our connective tissue, and those different ways.
So
So,
much to talk
yeah,
about here.
yeah,
So
that's so I just bridged it into
we're segueing. No, so
somatic
somatic. And
psychology. Yeah.
I know I had asked you earlier, but tell me again, what does
Mm.
somatic mean?
Yeah. So I specialize, one of my specialties areas is that I am a mind body psychologist. And now I'm increasingly like to say I'm a mind body soul. And
Hmm.
mushrooms is helping me bring in the soul part of the mind body soul. But the mind body part, so somatic really just means, it's, I think, Latin for the body.
Mm-hmm.
Um, the body. And so a somatic practitioner, somatic psychologist, because there can be somatic practitioners that do massage, but a
Mm-hmm.
somatic psychologist is somebody who
Oh,
brings into kind of the talk therapy. They also will bring in the body. They'll bring in breathing. I bring in sometimes yoga and breathing and walking,
okay.
auditory release, different types of embodied meditations. So basically, I just believe we shouldn't leave the body out of the equation. Let's invite the body into the
Right.
conversation, because the body holds its own story, and anything that we experience mentally, the body in a corresponding way also was there and experienced.
Okay.
It just speaks a different language. It doesn't
Yeah.
speak the English words that we're talking, but it speaks its own language as far as the way that we're breathing or yawning or laughing, or the
Mm-hmm.
body kind of popping or cracking, or feeling tight or
Mm-hmm.
stiff, or feeling ease, or body temperature, or each of our senses. What are each of our senses telling us? So, and we're really tuned in actually as little kids.
Okay.
We're most tuned in to kind of our essence, I would say, and to our body and sort of the primitive primal parts of our body. But then we're told as we grow up that we shouldn't be, doing, kids should be seen and not heard.
Right.
And I talk about that a lot in my TEDx talk. It's this idea of how we learn to override our body,
Okay.
because we're supposed to be these, basically we're told to be these
Like
machines that are
machines.
just, working and
Mm-hmm.
only in our heads. I think, therefore I am. And so we've really left out the language of the
Gotcha.
body. And like maybe we really just need more sleep, but instead we'll turn to caffeine and have more and more
Oh
coffee.
God.
We'll
Yeah.
override the body saying, I just need to go, I
Yeah.
just need to rest. So um, just to bring this whole conversation though back into psychedelics, is I do think that psychedelic plant medicine is a very embodied experience,
Mm.
especially the more that you take, an ayahuasca situation, or the higher doses, moderate to higher doses of psilocybin, of
Mm-hmm.
mushrooms. Then you will have a discharge of the body, even if it's just yawning. Or sometimes people will need to shake or move, or at really
Mm-hmm.
high amounts they might throw up. Not so much with mushrooms, but I think that's more of a situation with something like ayahuasca. And ayahuasca and mushrooms have their chemical compounds are the
I was
most
going to ask
similar.
you about that. So, is it similar chemical compound?
They're all more similar to each other than a lot of these
Okay.
other psychedelics, and they're both one's a fungi, one's a plant, but
Mm.
more similar than MDMA or something like that.
Gotcha. With so, do you believe that body pain, can be healed through? Like, what if I have a constant sore hip? Do I have like trapped trauma in my body, or?
You might. I
Mm.
think that it's worth factoring in the emotional element. It could be that maybe you are misaligned, and every time you go jogging, it's putting pressure on the bone. It could be completely
Sleeping
as
wrong or
simple as
something.
that. Yeah.
Okay.
But I do think that system by system, a lot of the things in our body, they're impacted by our emotion. Yeah, our emotional life is a huge part. I mean, we have 3 brains. We have this brain, that's the only one we've been focusing on, but we have a heart brain and we have a gut brain, and they both have their own nervous systems. And if you've been living a life that has been full of stress, then it will be literally a nervous system versus your nervous system. And so I think that accumulated stress definitely can, kind of the dis-ease of your life can lead to disease in the body.
Right.
So, a client came to me and said, can we talk through my hip injury? I would need to know a lot more information, and I would certainly also recommend them to go to some sort of other professional that specializes, whether it be a chiropractor or an MD or something. But I do think that it's always worth factoring in our emotional history. Absolutely. That absolutely makes a difference in our bodies.
Yeah. I was hearing somewhere, they were saying pain up in this like trapezius area, or just like constant, just discomfort. It's like feeling the weight of the world on your shoulders. So like, I feel like it's body stress somehow relates, or body pain to stress for sure.
We all have our own habitual ways of kind of gripping and constricting to protect ourselves from the stressors of life. Like I always say, my jaw is always taking on so much responsibility to try to protect me. And I'm like, okay, jaw, you can like, whenever I'm overthinking, really, really over processing, it starts getting tight. And so I have to sometimes just remind it because it can be at ease. We have to retrain our body, that it can be at ease. It doesn't have to keep living out whatever the previous earlier trauma was. So yeah, I'm kind of bringing in this kind of mind body somatic element with the psychedelics, because I do though think that a lot of psychedelic plant medicine is an embodied experience, that it impacts the whole body, because it has to bypass really also on the gut level before it kind of comes to the rest of you. Like I noticed that I will start yawning a lot as a form of discharge, as it's like crossing over sort of the blood-brain barrier for me to like notice it more. And so now what I love about that is that if I am yawning, I'm not thinking, oh, am I tired? I'm like, oh, this is my body doing a healthy discharge. It's trying to self-regulate to kind of get back to a place of calm.
I'm just curious, do you find yourself having the mushy yawns, through a microdose, any amount, or is it more of a mid-range, higher dose? For me,
no, I think any amount.
Oh, okay.
Yeah, any amount, but it's not. It's temporary. It's sort of, I'll yawn for a while in that period as it's like kind of transitioning, like really digesting in my system.
Yeah,
and kind of taking effect. So yeah, and then I'm done yawning, and I'm feeling clarity and noticing, dialed in.
I love the yawning, because then to me, it's an acknowledgement that the medicine is doing its thing, right? Or for me,
Yeah, absolutely.
I also wanted to get back to, you said you talk about yourself as a mind, body,
soul.
but then you were saying mushrooms might help, or maybe helping you use more soul versus body. Was that?
Well, I'm adding in. I've always sort of, as a yoga teacher, I've always believed, in soul and spirit, but I think I'm really diving in a lot more into the soul piece. And I do think mushrooms has helped with that, because it really, mushrooms, quite honestly, could help us connect more to a universal consciousness.
Okay, I want to hear more about this.
It's because it's really about understanding that there's this divine order in the world. So we are, most of us grow up thinking that if we want anything in life, we got to control it, right? And we got to do it all. And I think this is a huge thing. This is also part of what I'm writing about now too, is that I've grown up as a perfectionist and an overachiever, thinking that I just had to work so hard to make everything in life happen. And I really wasn't really religious, nor was I really that spiritual beyond yogic philosophy. But what I love though about mushrooms is that I really think that, this again depends on the dose, how much you take, kind of what sort of downloads and intuitive hits you might have. But there's this sense of recognizing that there perhaps is a divine plan to things, that we are cared for, that we are watched out for, that all these things around us aren't by accident. You know, like we're all kind of here and we're all connected. And we're all here to, like, on a soul level, like learn how to grow, how to be better, how to be, you know, kinder and more loving, to give and receive love. And so I do think that with psilocybin, you feel this connection not only to the earth, but to just sort of this larger idea of, like, what are we all doing here? It's not by accident,
Right.
you know, it's not all just because of man-made engineering.
Yeah.
And so, and I say this as somebody who has truly not been religious my whole life, but it's really bridged me into like a new level of kind of spiritual, as far as like, what are our souls here to do? And the mushrooms help us wake up to that.
Right.
Like, what, and how can you get your dysfunctional ego out of the way to be that kinder, more loving person to yourself, to others, and to what your purpose is? Like, what are you here to do? Just like how this is a big, beautiful part of your purpose here is like sharing this information,
right,
getting the word out about something people haven't been talking about, maybe they're afraid to talk about. And so somewhere along the lines, I imagine, like, the mushrooms, it has this own divine intelligence that said, like, what if I had a podcast? What if we took this away from being so secret, so people could also learn how to discover, you know, their authentic path as well.
Yeah, I mean, in all honesty, I had that heroic dose and connected with my grandfather, or he basically had said, Maggie, you are here to share your story about healing and help as many people as you possibly can.
Right,
But
beautiful.
I mean, hello, and I am the same, very non-religious, and it wasn't until this past year that I even started, like, you know, opening up to the idea that the universe can help us and is infinite. And so I've been, you know, something I've been thinking a lot about lately is wealth consciousness, because I think I've had these programmed, you know, I was just being honest, negative thoughts around money. Basically growing up, and just I don't know, turns out I do. So just, but it's the whole idea of when you said collective conscious, you know, let's talk more about, you know, why sit there and worry, or why have these negative, you know, that's never going to happen, or I can't do, you know. And it's about changing that kind of that voice, or is it the dysfunctional ego in your head? Is that what I want to first start there. Like, how many different egos are there?
Well, so yeah, I think that's a really good point. We need to back up and, like, what is the deal with the ego? And the thing is, because we'll hear a lot about with mushrooms or with ayahuasca or different psychedelics, that it's sort of this idea of ego dissolution. You have a certain amount and you'll hit ego death. And the thing is, our ego is never going to die. And there's also elements to our ego that we absolutely need. We just need the part of our ego that can be in service to our soul.
Okay.
So the dysfunctional ego is what I was talking about earlier. It's this idea of, it's that part of us. It's like, we're never enough. Others are never enough. We're competing. We're greedy. We're judging. We're judging ourselves. We're judging others. We're stuck in the past and old grudges, or we're constantly worried about the future. It's this sense of I and this separateness. But I, not in a way that's like, how can I contribute and serve, but like, how can I be better? I need to be better. And it's usually to help with, it's really about kind of these older wounds that we have. So I love this idea that we come into the world, this perfect soul, perfectly ourselves, and then challenges in the world, pain, confusion, cause us to create this ego in the default mode network of the brain. We won't get too fancy with the science, but in that default mode network of the brain, it's sort of where we start to, in our confusion, in our pain, we fill in the blanks. Like, I did something wrong. That's why mom's doing this, or mom and dad is not around, or she did something wrong. We create these storylines, and then we believe this as our identity. And then we also have storylines around our personality of, this is how I'm supposed to be. Your society tells me I'm supposed to be. As a woman, I'm supposed to be this, or as somebody in this socioeconomic status, I'm supposed to be this. So we have all this, we create this personality of ourselves, but personality isn't really the truth of our soul. But we do have elements of the ego that are healthy, that say, I do have a unique gift. I do have
Mm.
these unique gifts or interests or these passions that are really about helping the collective, that are about helping my family, helping my community, helping me be the best version of me. And
Mm-hmm.
so that part of our ego, we never want to have die or dissolve, and nor could we.
Mm-hmm.
And we need that. We just need to understand what is sort of, what are we here to do, and how can that part of our ego be there to help us.
Mm-hmm.
And then it takes a lot of work, though, for the dysfunctional ego to go away, because it's so intertwined with our sense of self and our identity. And think of how those stories
Mm-hmm.
just churn and cycle in our brain again and again. And one of the things that's been hardest for me that I've noticed, we talk about just all the beauty and the benefit of psychedelics, but quite honestly, what I have to confess has been hard for me is it's made so crystal clear when I'm in dysfunctional ego. Whereas
Mm.
before I would do it and I would just be like, let it go. But now I catch myself. I have a thought, I have a judgment. Immediately I'm like, there's ego, there's ego. And even there's just times when I feel like it rebounds because it's actually fighting for its life. Like it
Oh,
doesn't
okay.
want to lose its identity.
Mm-hmm.
So I think it's normal and to be expected that there can be a time period, kind of depending on what you're going after, your goals, your intentions, and how often
Mm-hmm.
you're engaging. For me, a big part of my goal and intention is to let go of dysfunctional ego. So I'm noticing it all the more. I'm
Oh,
noticing when
right.
it
So,
rebounds. And
mm-hmm.
I have to be gentle versus mean to myself or hard to myself. Like there you just had a judgment or a self-criticism, or you
Mm-hmm.
just did something that was selfish, or you wanted,
Mm-hmm.
because it's this is also just part of our learning and part of our being human as well, right? We
Right.
notice it, we practice, we
Mm-hmm.
try to let go, to try to be more of a kinder person, a we person versus a me person.
Mm-hmm.
But so I just want to say that because I know that it can be, people can be really hard on themselves, which is again just kind of about me and ego.
Right. So when we talk about psychedelics and having or experiencing a full ego death,
Yeah.
um, let's talk about that. Is that just um, the dysfunctional piece, or I guess
Oh, yeah.
I want to hear more, or I'm interested in. I've been hearing it a lot lately. Ego death, full ego death. Like, do you
Yeah.
know how or when that's happening, or do you think it's slowly chipping
Yeah.
away the more work you're putting in, um,
Yeah.
and being more aware, like you were just talking about?
Well, if you certain things like something like DMT, I mean 5-MeO DMT, there's certain things where and then the hero's dose of mushrooms. I mean, there
Hmm.
is understood that you have an ego death for a certain period of time.
Okay.
Say it's for 2 hours or something where you're just truly connected to the
Hmm.
universe, to whatever's around you, to beauty, to Mother Earth,
Right.
to kind of your soul.
Hmm.
And then you start to come back and you kind of realize, and the effects of the medicine wear off. And then the work of integrating it. That's a big part of what I want to do with
Yes.
my psychotherapy practices. There's more and more people that are using this medicine, but then they don't have people to help them integrate it into their lives. And that's at least half of
I
the, yeah.
didn't. I
Yeah.
mean, I am so thankful to have you here and to know you. Just because I think for me everything was very haphazardly. It was
Mm-hmm.
I knew that I was able to quit drinking, so I knew there was magic, and I'm like, I'm gonna just keep. I felt comfortable to try more and more, but just that whole piece of kind of like what just happened, why,
Yeah.
and I think that it's a crucial step. And yeah, I love. I want to hear more, but like what gets you excited about that, or because it's helping people really
Mm-hmm.
define the experience more, and also
Yeah.
um, just putting the pieces together even more,
Yeah.
right?
Yeah. And just to also finish answering your previous question, I do think that so that ego death that
I'm
happens
sorry.
at these higher doses, but
Mhm.
then you come back and your ego comes back. And
Mm.
but hopefully had more of the observer stance of like how we could be without and how it
Yes.
felt to be free from the dysfunctional ego. And like that's what I think people want to hang on to
Okay.
and what they want to integrate into
Yes.
their life. They want how they felt connected, how they felt optimistic, or how they felt like everything is part of a plan, and how they felt the forgiveness for the person they were holding grudges for, how they felt connected to animals and the earth, all of that. They want that So they need the integration, I think, to help when
Right.
dysfunctional ego, personality, that kind of thing comes back in, because it will. It will, because that's what we've known our whole life. Is like, I'm supposed to be this way, and these, those storylines are so well tread. So, so I think that that's sort of how I would explain this ego death that happens.
Okay.
But the goal is not to like walk around never having an ego. That can be a problem too. There are some people that like they're just so like, hey, it's all cool, whatever. They're I'm not trying to put them down so much as, but like we need a certain sense of self, a certain amount of ego, like, hey, this is like, these are my proclivities, this is my beliefs, this is what I love. Sure. This is what I'm here to do, here, how I'm here to help. It's, there's elements to that personality that is like what distinguishes us. And that is part of our soul that it's here to do and to be that unique, authentic person that we are.
Yes.
So some people might describe ego in different terms. I usually say ego or personality, or kind of that constructed self versus our more authentic self, or our essence. So that's a lot of what I'm really excited about for the potential in mind, body, spirit, mind, body, soul health for people. I do sometimes worry that talk therapy exclusively is it's sort of perpetuating those storylines, right? You come into your therapist and you're like, I'm so mad at my brother for doing this. And then you keep talking about how mad you are at your brother and how the brother wronged you and you didn't do anything, versus like, okay, how are you human to human? Like what happened? Like, what are the traumas you came into? Like, how are you feeling that in your body? Like, how is this, how can we actually free ourselves from being kind of stuck in this story? And I need, I was wronged and I'm a victim and all of these things. And so that's what I sometimes worry about with talk therapy. Not all therapists do that. A lot more therapists are holistic and trying to help people kind of come out of those limited storylines. But that is sometimes a problem with talk therapy exclusively, when you're only looking at stories.
Right. I have similar thoughts when it comes to, for example, an AA meeting, because it's, I've only been to one, but the idea is like, keep talking about the story, that brought you there, and, I'm not dissing AA or anything, but a big part of my, passion and purpose is the other options for sobriety. But and I worry about those people too. But I think for some people it helps them, realize they're lucky and have made such change from what brought them in. So
yeah, I think the community,
the
supportive community is really, I don't think anybody would doubt that is powerful. I do sometimes wonder about over identification of self as an addict.
Oh, I see.
Of self being powerless. And to say again and again, I am an addict, I'm an addict. And because what I think is, it's like on the soul level and the human level, we're all so much more than our addictions or our ways that we want to numb or escape. Like there's so much more. I mean, you're infinitely more.
So this kind of gets back to that whole like collective conscious, like proclaiming I believe is what I'm starting to realize. It's, those positive thoughts filled with belief and, almost like imagination or creating. So I can see where you're saying like, I'm an alcoholic. Like
it's so limiting.
Yes.
It's limiting. And it's, I think it's because it's coming out of the Western model of, which puts us in a box that categorizes us, that labels us. I mean, that's what diagnosing is. That's what insurance asks us to do, is diagnose, put you in a box. But we're so much more, we're infinitely more than that. We're all so much more than that. And really the addiction is really just a symptom of a larger issue. And it's probably about older trauma. It's probably, could be about something in the family. Yeah. And so those labels and boxes, they really don't get to the heart of the matter, which is that somewhere along the lines, we were hurt and we didn't have the support we needed. And we weren't understood on the soul level that we deserved, that we needed. And so now here we are, recognizing the healing that we deserve to receive, the love we deserve, the forgiveness, self-forgiveness that we all deserve. So I do think Western psychology has left out the soul. It's left out the body, and it's starting to bring in the body with somatic psychology, but it's left out the soul, and it's left us in these ways of being really hard on ourselves, pathologizing these labels.
Right.
And I think there's a time and a place for diagnosis just to help us understand treatment, but also it gets overboard of people thinking like, I am depressed. Well, the depression is really just a symptom of something larger, asking for help, some sort of grief probably, or some sort of acceptance or letting go. And I really do think that psychedelics, I have personally, for me, ever since I started years ago with ayahuasca and mushrooms, it has been like layer after layer, chipping away kind of all of my own trauma that I thought that I had worked through. Like, believe you me, I thought that I had worked through it as a psychologist, but it takes you deeper. It really takes you deeper. And so in some ways, be careful what you wish for. Like, but at the end of the day, this is the only path. It's the only way out is through. And it's a beautiful process. You just need support. You need integration. Help. Now, for people doing smaller amounts, like microdosing, it's not going to bring up those sort of traumas. It's going to be much, much milder. Microdose, you're technically really, the definition means you're not even really noticing anything so different in the moment. Yeah, perceptual.
Yeah, it's so funny. A lot of people ask, obviously if it's their first time trying a microdose, they want to know, what am I going? How will I feel? Will I appear high? And I'm like, well, I hope not, because you probably shouldn't be feeling much at all anything, and I constantly say, if anything, it's just, to me, it's more of like a performance enhancer. I've got some pep in my step. I feel a little conversational. And then I also want to say, with microdosing, I don't feel that it's the same every day, every time you're having a microdose. I think you can have your up days and your beautiful days, and then not that there's sad days, but there's just a different tone to it. And I think those are the days where you want to maybe pay attention about what's the thoughts in your head, and maybe journal, because I feel like those are the working days, or I don't I don't know.
I mean, I really look forward to the time in which I can legally prescribe this to my clients. I just actually earlier today I was talking with a client. She's 18, and her psychiatrist has her on so many medications, all of these substances, these synthetic substances that are really like numbing and dulling her, all because of behaviors she's had that were really natural for a teenager. Teenagers.
She's 18.
Now, I mean, she's 18, so she's technically an adult, but we're working through her, and I'm going to talk with her psychiatrist, but helping her get off of all of these really unsafe and ineffective pharmaceuticals. And that's what I think is really the crime, is that is legal, and yet the fact that mushrooms are not.
Absolutely. I'm very interested in, learning how, I mean, obviously privacy issues, but I think that is such a huge thing that our society is dealing with. It's like, wow, I've been on Adderall for 14 years, and I've been taking SSRIs for 17 or a decade, 7, whatever it is. And then realizing, okay, well, if I ever want to try and kind of wean off or come off of this, like, where it's such a, that's a lot and to figure out. And I'm not necessarily saying to substitute it with psychedelics at all, but it's just like, that's all that
I will say it.
Okay, thank you.
I will say it. I want to substitute. I think for a lot of people, they would do so much better by having psychedelics, dosed by somebody who is prescribing, who knows what they're doing. But if we replaced pharmaceuticals, which are unsafe and ineffective, with prescribing with these psychedelic plant medicines, now it might not be for absolutely everybody, but by far, that is the direction we need to go into. I mean, 100%. And they're so much safer. They're so much more effective. They're so much more, if it's managed, if the amount somebody's taking is managed by somebody smart, then people taking it willy-nilly, that's where sometimes problems can happen.
Right.
Taking too much and being alone, that's when people have bad trips. But even so, nobody gets violent from mushrooms or anything.
I know.
So yeah, I really look forward to the day that I can just openly prescribe that people take microdose mushrooms. I think we're getting there, and it might still be a couple of years or so, but I'm not sure exactly on the timing, so don't quote me on that. But it's not soon enough. Well, let me just put it that way. It is not soon enough, and a lot of these pharmaceuticals are very unsafe. Some of them are helpful for people, and I think that some of them are really valuable, especially with acute symptoms of their suicidality, homicidality. I'm not saying that all aren't helpful. There's a time and a place, but for these long-term use, especially for like normal developmental stages or existential issues, they're really just a band-aid. They're numbing people. They're not helping.
Oh, and to your point about your client earlier today, or the 18-year-old, and it's just kind of like, it seems like that's just kind of,
Yeah.
I know. Okay. Yeah. Well, I can't wait for that day either. And I think obviously just keeping the conversation going. And I love to hear that from you again, because it's, I still feel like there is such a stigma, and it's not even, the stigma, it's actually just acknowledging that, on the basic level, that some of these plant medicines or psilocybin, to hear you say that would be way better, or not for everyone, but potentially, that's to me huge, and very exciting. Yeah.
Yeah. I mean, I guess that's where doing more legislation and who knows, but it's something that there's a whole underground world of, there's so many psychologists and psychotherapists believe in this, that there's just more and more of us that in an underground way are ensuring that people get access to it, because we can't wait for society to catch up. Like there's too many problems. There's too much damage out there. There's too much violence. There's too much, and the pharmaceutical industry has too much at stake. There's just a lot of reasons why it might take too long. And so I think myself and a lot of people in the mental health world are trying to figure out ways just to, and clinical trials, if you really want to do this in a way that's, fully legally, there are clinical trials that you can get involved with. And I would say definitely encourage people to do that, to see if you're eligible or not. But this medicine isn't called to everybody. And so that probably means they might not be ready. Or they just need to learn more. But, so I'm not trying to force people that don't want to do it. I think there are people who are afraid of losing control. And that is sort of their own hurdle, that's actually their own problem, is that they want to have so much control that the fear of surrendering, right?
No, so true.
So like the very thing that would be the medicine for their control issues, they won't engage in because they need to have so much control. I certainly know some people like that, where they either believe that it's unhealthy or going to lead to a bad trip, or they're just so afraid of losing control, even though they'll do it with a beer, they'll do it with alcohol, because that's the type of letting go of control that they're more familiar with. But the thing is, control is an illusion. Like every single day, we're actually, we don't have control over the weather. We don't have control over traffic. So they're already living with that lack of control, but they're fear-based when it comes to it.
Yeah. And I think the whole knowledge of starting low and going slow is a real safe and easy way. I mean, that's the beauty. You can have the smallest of the smallest, and even that accumulated over a period of time can provide relief from, studies show, depression and anxiety. Well, let's talk about a little bit about you and some of the work you've been up to. So Rachel has written your first book, which was called...
My first book is called The Pleasure Is All Yours. That came out in 2021. And that is really looking at this expansion of mindfulness, because it leaves out the body so often. So I talk about bodyfulness. That's a lot of what I really want to help people with, is bodyfulness, is embodied mindfulness, but also helps them reclaim pleasure and joy in their life, given that we have such really antiquated notions around letting ourselves feel good and feel good in our body and receiving pleasure, and especially women. So it's really bridging bodyfulness and what is bodyfulness, and then how could that be a way to also reclaim our birthright, which is to feel good, to feel pleasure, to feel joy, especially within a repressed culture like the U.S. And then now I'm starting to slowly work on my second book, which is really looking at it's kind of this path from sort of cynical to mystical, and it's rooted in my own life past of being more cynical to things that have to do with more of, like I was saying, universal consciousness and kind of a spiritual side and a soulful side. And what does it mean to have a soul? And what does it mean to bring the soul into Western psychology, which has left it out? And how we can tap more deeply into our soul's purpose, being our best selves, and letting go of some of that dysfunctional ego. So
wow,
I'm not sure when that'll come out, just chipping away, living it right now and writing about it right now. So hopefully in a couple of years.
I love it. And you've also done a TEDx talk, right?
Yeah. That talk is called Pleasure to the People. Yeah, and I have a shirt that goes along with it that you could buy on my website. It says Pleasure to the People. And actually, that's a good time to mention that I'm about to have on my website a shirt that says Mushrooms to the Masses.
Yay.
So my brand got Pleasure to the People, and then we'll have Mushrooms to the Masses. So that's the new shirt that should be out any week now. But yeah, the TEDx talk is also based on the book and that idea of bodyfulness. And bodyfulness is a path to help us awaken within our own bodies, an embodied way to awaken to coping within, self-regulating, so we can feel life's pleasures.
I need to read this book. It's like I want it. Well, always exciting, and I appreciate you. You have written some articles on psychedelics for Psychology Today, right?
Yeah, the column with Psychology Today, their online platform, and I wrote 2 articles, a 2-part article on ayahuasca and then one on mushrooms. And I'll probably keep writing more. Maybe I'll write one on ketamine or bufo or just different applications and the potential. But mushrooms among them all, I would say, I think it's just the most graceful, sweet, gentle way to see our trauma and to see our light. I think that everybody's got their favorites or what, psychedelic works for them. But I think that if anybody out there is listening and is just, how do I start? Mushrooms, I really think, is the one that is best to kind of get started on is microdosing mushrooms, because it's really so sweet and gentle. It's a very kind way. Some other things can be a little, like ayahuasca sometimes can be amazing, but also it's a little bit more of, it's a little more aggressive in showing you maybe the ways that you get in your own way.
Yeah.
Kind of all the trauma you got to maybe get through first, not always. But whereas mushrooms is really, there's something about it that is so heart-centered. It's so heartful. Right.
I agree. And I appreciate you saying that. And I think that for the viewers, it is. Well, I wanted to ask you real quick. So did you start ayahuasca before psilocybin?
No, psilocybin was first. Okay. Yeah. I had maybe 5 years before ayahuasca. Okay. But I had not done a hero's dose. I had done more moderate, kind of middle of the road doses. So it wasn't really so much therapeutic as it was just curiosity, playfulness, real appreciation of just the beauty around me in life. I think what's important with all of this stuff is the intention you set. And I probably should have said that at the very beginning. All of this stuff, it really asks for, like, what is your intention that you're bringing? And I think not only is it just a beautiful thing, but also your mind can go in so many different directions when you take psychedelics, that you want to have that intention to kind of keep you focused on, like, what really needs the most attention? What do you really want to work on? And sometimes it'll take you elsewhere because it takes you maybe what it thinks you need to focus on the most versus what you think you need to focus on the most. But the intentionality is a beautiful part of medicine too. And you don't see that so much with, like, how we pop pills with pharmaceuticals and stuff. We just want to numb, we just quick. We don't want to think about it. Coming to all this with intention.
100%. Yeah. Yes. And have you done one ayahuasca journey or more?
I've had 5 ceremonies.
Oh, goodness.
5 ceremonies. Yeah. Wow. Yeah. I've told myself it's about a once a year sort of thing.
Oh, okay.
Because because there's a lot of integration. It's a lot of I guess I've, I always think of like ayahuasca and mushrooms are similar, but ayahuasca is like, it kind of comes at you. It's like a bulldozer, like
Right.
excavating like a big piece of machinery. Whereas I feel like with mushrooms, it's like just kind of a like gentle, like grandmotherly, like stroke on your shoulder, being like, hey, why don't you take a look at this? Let's just take a look at this one first.
Just like this.
Yeah, just a warmer, fuzzier way. Now it depends also on the strain that you might take. Some strains of mushrooms are going to be a little bit more aggressive. Absolutely. Golden Teacher is the one that I have gotten to know the best. As you know, it's always my favorite because it really is, the name is true. It's like this very sweet Golden Teacher.
And I feel like with the Golden Teacher, you just know what you're going to get, right? Or, I mean, at least that's how I feel, as the name speaks. And then there's other varieties where some of the names are just so out there. Hillbilly or penis envy,
Yeah. I know. I wonder who's sitting around naming
Rabbit. Them. Yeah. Well, awesome. Thank you so much for sharing all the things you know. Spectacular conversation. And again, thank you for opening up. And I really just appreciate you sharing your views, how this plant medicine literally could change lives, if not the world.
Yeah, I believe so. Absolutely.
Okay, Rachel, I appreciate you so much.
Thank you for having me.
Yes,
Thanks,
thank
Maggie.
you, and you'll be back.
Okay.
Thank you, everyone. For more information, please visit mindsonmushrooms.com. Thank you for joining the journey.